Hello students, good morning to all. Welcome to your class of pharmaceutical chemistry to the pharmacy second year. I am your teacher from Guru Ramdas College of Pharmacy. Today we continue our previous chapter what are the diagnostic agents. So let's we start. We discussed already what are the diagnostic agents and what are their uses, how they are used, and one of the classification are also um, done in the previous class. So here just we review the definition of diagnostic agents. Diagnostic agents are the chemicals or substances used to detect the abnormalities in tissue and organs or to test an organ function. Do not have any medicinal and pharmacological effects. They are just drugs or agents used to identify or to detect the abnormalities of tissues, organs, or any part of area which injured due to any kind of accidents. And these observations are can predict on X-ray. So X-ray film used for radiography. Radiography visualizations are done by using the diagnostic agents. Some kinds of radiographies are mentioned here, which are used for a particular part of body or organs, like angiography. Angiography, it is the used for heart radiological visualization of heart and its blood vessels. Arthrography for visualization of detection of joints. Bronchography, it is used for lungs to detect the lungs, if there is more fluid or collected or stored in lungs. Next one is colonography, that is used for gallbladder and bile duct. Hepatography, and it names shorts meaning that is for liver, and most probably to check out the uh, if the liver functioned properly or not. Next is lymphography for lymph nodes and vessels, myelography for brain and spinal cord, pylography for kidney and ureter, splenohepatography for liver and spleen, urography for urinary tract. So some of the these are the few terms which are used in medical terms to uh, mention our to sorry to detect our organs, to check out their abnormalities if there are. So these are also covered in the diagnostic agents when we go to through their in detail and what are their uses. So these are the terms used for the particular organs. Next one, so let we start our next classification, that is compounds used to test the organ. So there are many compounds which are used selectively in testing the functions of various body organs like kidney, liver, cardiovascular system, and for various diagnostic purpose. Most commonly used agents are, the first one is agent for kidney function test. First one is amino hippuric acid. And what are the properties and uses? It is a white crystalline powder and darkens on exposure to light. So it should be contained in a airtight container and should be a light resistant container. It is soluble in water and alcohol, and also soluble in acids and alkalis. So the sodium amino hippurate injection is officially in USP sodium, and it is a given intravenously in 2 gram dose for renal functional determination. Next one is indigo caramine or indigotin disulfide sodium. Here is the chemical structure here. What are the properties and uses? It is a blue colored powder, occur with crystals, and it is surprisingly soluble in water and alcohol but almost insoluble in chloroform. it is affected by light too, so it also should be contained in a light resistant container, and it is administered intravenously, and its given dose is 40 mg. It is used for the renal functions, to estimate the rate of excretion in urine, and also to locate the urethral orifices, and it also used as a coloring agent in laboratories. And what is the urethral orifices? To locate the urethral orifices, matlab, to find out their position, exact position or shape. And urethral orifice is a opening opening of a ureter into the urinary bladder at one corner of trigon of bladder, called it is also called urethral meatus. So to locate their position in a urinary bladder, this drug is used to detect it. Next one is phenol sulfophthalate, and it is also known as phenol red, but occurs in a red crystalline powder, slightly soluble in water and alcohol, but and more soluble in solutions of alkali hydroxides and carbonates. Uh, it is used to detect the renal functions, and also used as a base acid base indicator in the laboratory purpose. So, next classification, these drugs are used for liver function test. So first one is sulfobromophthalate sodium. So what are the properties and uses? It is a white crystalline powder and odorless, hygroscopic in nature, soluble in water, insoluble in alcohol and acetone. And sodium injections are also available of this preparation in 50 mg per ml dose, and injection is used in the ratio, that is 5 mg per kg of body weight, given intravenously, and it is used to test the hepatobiliary function. What kind of hepatobiliary function? Is the liver um, uh, function properly, that is to drain out the waste product from liver into duodenum? Is it running correctly, or to help in digestions with controlled release of bile? Such kinds of functions are done by this function, hepatobiliary function, and to diagnostic this, the such agents are used for this purpose. Next one is miscellaneous diagnostic agent. First one is Evans blue. Evans blue is a one kind of an azo dye that has a very high affinity for serum albumin. It can be useful in physiobiology, in estimating the proportion of body water contained in blood plasma. So, what are the properties and uses of Evans blue? It is a blue crystalline substance with the greenish luster or brownish powder, very soluble in water but slightly soluble in alcohol, and practically insoluble in organic solvent. Its aqueous solutions are stable, and they are sterilized by autoclaving. Evans blue injection given in for 0.45% of Evans blue is given intravenously to determine the blood volume, and dye contains with plasma albumin when injected, and color is directly proportional to its concentration. It depends upon its concentration. Next one is fluorescent sodium. Properties and uses: it is a orange red colored, and hygroscopic in nature, odorless powder है. It is soluble in water but sparingly soluble in alcohol. Fluorescent sodium injections are also available in the form dose 50 and 100 mg per ml, employed in 500 mg dose intravenously for the determination of circulation. And a fluorescent sodium ophthalmic strip is used to detect diseased or damaged areas of the cornea, like corneal ulcers, which get stained green. Next है indocyanine green. Indocyanine greens, it is a dark blue color or a black powder in, and its solutions are deeply emerald green in color and acidic in nature, soluble in water, alcohol. It is a sterile solution, and its concentration is 5 mg in 1 ml. It is used to determine the cardiac output, and in the ratio of 500 microgram per kg of body weight. It is used for determination of hepatobiliary function. The next one is histamine acid phosphate, and it is a histaminic agent that stimulates the secretory cells of gastric mucosa. This drug is used to detect the secretory function of the stomach. So histaminic acid, what is the purpose of this drug? Used for the stomach secretions, comes out from the stomach. Next one, insulin. It is a polysaccharide that is obtained from tubers and white in color, amorphous and hygroscopic powder है, sparingly soluble in water, and it is given intravenously and used to measure the glomerular filtration rate of kidneys. Next one, pentagastrin. It is a pentapeptide. Aqueous solutions are sterilized by filtration and are used to detect the gastric functions. And it is officially mentioned in BP. Xylose, white powder with a sweetish taste, soluble in water, given orally for testing the absorbing capacity of GI tract. Concord, brownish red powder, soluble in water, ethanol, insoluble in ethanol. It is employed as a diagnostic and amylo iodizes. Also used as an indicator in laboratory. So hence, this chapter of diagnostic agent is done now. So thank you.